Welcome to The Voice of Value, the podcast that delves into the heart of business and explores the value they bring to the world. Your host is Dr. Roger Mochigemba, a direct primary care physician and a visionary entrepreneur. Each episode, he'll be talking to business owners and leaders from a variety of industries, discovering their unique stories and understanding the impact their companies have on their customers, employees, and communities. He'll also uncover the secrets to their success and learn how they tackle challenges in today's fast-paced world. So grab your headphones and join us on this journey as we explore the essence of value in business. This is The Voice of Value.
I am so happy to be here with another episode of the Voice of Value podcast with my friend Michael Gorton, who is a 14-time serial entrepreneur and one of the pioneers in telemedicine and digital health space and many other businesses. Michael is a best-selling author as well. He has a book called Broken Handoff, where he gives advice and lessons learned from his entrepreneurial experience. He has a BS in electrical and engineering and physics from Texas Tech, an MS in space physics, an MS in physics and engineering, and a JD from Texas A&M. So I met Michael many years ago when we started working on Teladoc. So I'm so happy to have Michael join us for this podcast because we're trying to show value in business in what we do, and hopefully we'll be able to inspire upcoming entrepreneurs and give advice and to business owners and CEOs as we talk. So thank you, Michael, for joining me on the podcast today.
Roger, it's always a pleasure, and there's nothing better than helping that next generation. So kudos for your podcast and your goals.
Thank you. So I was thinking about the great things you've done as far as the many ventures that you've created and how successful they were. And I was wondering, if there are some things that you could share from early in your life that kind of shaped you into becoming the kind of visionary and entrepreneur that you are. Was there an event, a process, or a role model that you can identify and talk to us about?
Yeah, but I have to give away my age. I was a very, very young kid in front of a black and white television in the middle of the night in the Philippines, July 19th, 1969. Saw these guys step out on the moon, and I just thought that was the coolest thing in the world. And because I was in the Philippines, Boy Scouts and Cub Scouts were in the same group together. And my C-130 pilot scoutmaster, I said, man, that was so cool. I want to go to Mars. And he said, well, if you want to go to Mars, build a life plan. I mean, how do you tell an 11-year-old kid build a life plan? But we did, and I kept that plan for a long time, and it drove me. What do I need to be the first man on Mars? I have to be an engineer. I have to be a scientist. I have to be a doctor. And I got through the first two, and then I defected to the dark side and became a lawyer instead.
Oh my gosh. Well, I won't ask you what deflected you there.
I'll actually tell you because it's relevant to the story, and that is, I was already early 30s, and it occurred to me that we weren't going to Mars when I was young enough to go to Mars. And I was working in a major corporation that had 30,000+ employees, and our CEO was an electrical engineer, JD. And I thought, well, if I get a JD, I'll be an electrical engineer scientist JD, and maybe he'll become my friend, and I'll be CEO someday. So I stepped out of the whole I mean, I had already taken the MCAT. I'd already been accepted in a medical school, and I just went,
Wow.
no, I'm not going to go.
Wow, that's awesome. I really love that story about when you were 11 years old and you made up your mind, and then for a long time that drove you, like you said. That's
Yeah.
awesome. And then you stuck with it. That's so cool.
Yeah. For
Was
like
that
20 years.
was that a at that time, was that something that you and your scout leader wrote down on paper?
We did. I wish I still had that piece of paper.
Wow,
You know,
that's amazing.
it'd
That's
be framed behind me there.
yeah, that is awesome. So Michael, over the years, how do you determine if a novel idea will thrive,
Yeah.
and if you can make it work?
Um, well, look, Roger, you and I have known each other long enough to know that we have lots of great ideas, and sometimes they don't make it. It doesn't matter how hard we
Exactly.
work. Circumstance
Exactly.
just doesn't work with us.
Hmm.
But what I have realized is that every single endeavor produces a level of education and learning. And so there really are no failures. But, I certainly adhere to the world of thought that you don't fail until you quit, and you never quit. So, regardless of where the business goes, you learn something, you use that to take you to the next level.
Very good. Good. Okay, so Michael and I started working together when he was developing Teladoc. And as I recall, back in those early days, Teladoc was a membership model, right?
Mhm.
Um, why membership, and why did you market or sell that to employers?
Well, in the beginning, um, Dr. Brooks and I talked about just calling people and saying, hey, it was more like a concierge type medicine with telemedicine as the foundation of it. And it just didn't work. We couldn't find enough people that were willing to pay it. And as a serial entrepreneur, Teladoc was my eighth startup, like that, right? And
Mhm.
um, I already had a lot of friends who are building business, who had started businesses, who had successful businesses. So I started calling them and saying, "Hey, I can keep your employees at work. I got this great doctor named Roger Mochigimba who will take your phone calls day or night." I remember those old days, Roger. You'd be driving somewhere, you'd pull over the side of the road, figure out a way to get connected to the internet, and you do consultations. It was a critical part of the success because we promise people, if you join, we'll get a doctor to you in 3 hours or less. And in the early days, that doctor was almost always named Roger Mochigimba.
That's right. Yeah, I remember that very well. I I had a tablet computer that was small enough that I could carry with me everywhere, and
Mhm.
we didn't have Wi-Fi quite as extensively as we do
Yeah,
now in 2004. So I found some other solutions that I could carry with me as well to try to boost my signal. And yeah, my phone was. I remember back in those days, consults were few and far between, like a
yeah,
handful a month, and
yeah,
so it was it was wonderful to me as a doctor to be able to just reach out and take care of somebody this way, because um, from my perspective back in that day, it was it's just not the way it was done formally, right? But
mhm,
we all knew, you and I knew very well, that doctors were doing this informally in the form of cross coverage for their
right.
colleagues. So we just kind of formalized that and put some quality around it, and grew it. And it was a wonderful ride.
It was,
Um, mhm.
and it still
And
is. I mean, look at the industry
yes,
now.
Oh yeah. And I remember um, when the pandemic got started, you and I spoke, and we were thinking how great it was that we laid the foundation for something that would be that would take care of so many people during a time as stressful as the pandemic, when
Mhm.
access was so choked and people were so scared. Um,
And
but
you
I
know, I love the pandemic for that very, I mean, that's a strange thing to say. I love the pandemic. But if you think about the 2019 side of the pandemic and the 2023 side of the pandemic, a lot of people were using telemedicine, but a lot meant probably 5, 6% of the population. If you
Mhm,
come to the other side of the pandemic in 2023, there was a study that said 87% of the US population would rather use telemedicine than going to visit their doctor in person.
mhm.
Wow.
Wow.
The pandemic was really painful for a lot of us in a lot of ways, but for telemedicine, it just blew the doors out.
Yeah, it was a lifesaver.
Yeah.
Um, I love what you said also about how when you started Teladoc, you you were reaching out to your friends and other people, but it just wasn't quite a good fit. But then you made what we call a pivot or an iteration
Hmm.
to start talking to your business owner friends.
Right.
Yeah. So
Yeah.
you
It's
didn't have it
I
all planned out the way it turned out, right? And that never happens in reality,
right,
right?
right.
Yeah.
Yep. We pivoted and pivoted and pivoted with Teladoc. I mean, we always kept the main idea, which was we can get a doctor to a patient very quickly. The doctor will have the medical record and make a decision. Is this something I can treat, or is it something that I need to send to a hospital or an emergency room or somewhere else?
Right. And so now with that idea and the the framework that we started with, what was it like, or how did you take this new idea that was outside of mainstream medicine to large companies and let them know that you had a solution for something that they might not have even realized needed to be fixed?
Hmm. Yeah, I think in the beginning, it was friends of mine who were CEOs. We got a little bit of momentum out of that. But then when we started getting bigger, a secret weapon, because I kept thinking, how can I get to the CEOs of really big companies? They wouldn't take my phone calls. And there was a guy on our team named Don Lightfoot, who was a sales guy. And I remember Don saying to me that Buzz Aldrin is a friend of his. And I thought, yeah, sure he is. And remember, I started this story today with me, 11-year-old me, watching Neil and Buzz walk on the moon,
Right. Cool.
and so the sort of happy ending to this is I remember saying to Don Lightfoot, prove it. I want to meet him. And I think I did that on a Friday. On Sunday, I got a call from Don and he said, "Hey, can
Mhm.
you be in LA on Tuesday?" And I looked at my calendar and I went, "No, why?" And he said, "Well, you could have lunch with Buzz Aldrin." And I said, "Yes, I'm canceling meetings right now." so, so I flew out to have lunch with Buzz Aldrin, which lasted from probably 11 in the morning till maybe 10:30 that night. So lunch went a long, long ways. A really
Wow.
good connection was made. And when I was flying home the next day, I was thinking about how he had so much interest in telemedicine, and I really enjoyed my time with him. And so I called him up and I said, "Hey, could you be an advisor?" And he said, "Okay, I don't know anything about telemedicine. I'm not a doctor. I'm a aerospace engineer and an astronaut." And I said, "Yeah, but there's not a person on the planet who won't take your phone call." So I explained to him, how we had been growing Teladoc that far by me calling my friends, and now I really wanted to talk to the CEO of AT&T and T, and Aetna and, the big companies. And so Buzz became our secret weapon.
Wow, that's amazing. I remember coming to Dallas for a meeting and meeting Buzz.
Yeah.
But
Yeah. He's right there behind me.
yes, that's awesome. I didn't realize how much of an impact he made being on that advisory board.
Yeah. Yeah. I think probably maybe 25 or 30 meetings that he helped me get, but they were key meetings.
Wow, that's wonderful. I'll bet you had a great time talking with your space background and his space
Yeah.
experience.
Yeah.
Yeah. Uh,
Yeah.
um, so, Michael, what um, what principle of value do you think you might be able to attribute the great success of Teladoc to?
Yeah. One word, persistence.
Okay.
Um, you know, we got knocked down and kicked in the teeth a lot. You remember, in fact, I remember the first time you and I met, uh, Dr. Bruce Bija introduced us, and you had the Texas Medical Code right there in your hand. You handed it to me and you said, "How are we going to do this with that?" And we talked about it quite a bit, and how cross coverage was the answer to the question, how we were fixing the broken way of after hours cross coverage. Um, but I, uh, we had lots and lots of challenges. I mean, I don't know if we told you about the time when Dr. Brooks and Boltinghouse and I went to the Board of Medical Examiners and they said, "You're going to go to prison. If you build this company, you'll go to prison." And you guys were safely nestled down in San Antonio the day the DEA came into our office with guns and badges. But they made their way down to San Antonio and went through y'all's files too. Um,
Mhm.
so I think the thing is, if you're building something great, you have to know why it's great, and if you believe, then persistence will win. And that's what Teladoc was all about. We didn't come up with the idea. That was in 1968 with Jay Sanders, who had just come out of Harvard Medical School. Um, all we did was we figured out a way to get it into the mainstream.
Mhm. Another thing, and I learned about those things, but I think it was after the fact. But I, a couple things from my perspective is, um, I, I, and this might be a clue for some budding entrepreneurs or investors, is that um, a lot of the success of a new venture depends on the people. I mean, ideas, there's lots of good ideas, but it takes the right kind of people to make it grow and thrive. And so I had confidence in you, and I guess you had enough confidence in me that we could start the way we did. Um, but then the other thing that I had confidence in, as far as my position in the startup, was that I knew as a doc that I could take care of people this way for certain things, and I knew
Mhm.
where to draw the line.
Yeah.
And I wasn't. I mean, my incentives were just aligned on the patient. And you, in the quote unquote business office, on the on the business side, you were taking care of the growth, the cash flow, and all those other things. um, so that was from my perspective, I knew that uh, we could provide value that way, and people needed that because it just made sense. It just wasn't formalized in mainstream medicine yet.
Yeah. Yeah. I used to tell people that it was like fire ants. So in Texas, we know what fire ants are. You go out in your front yard, there's a little mound of dirt. You don't want your
Mhm,
kids stepping on it. You don't want to step
mhm,
on it because if you do,
mhm,
there's a lot of pain. Um, in healthcare, prior to Teladoc, the way we handled fire ants was we called the Pentagon and they sent tanks and a battalion and air support. With Teladoc, it's that teaspoon of whatever we have in our garage that we go put on the ant mound and we solve the problem. Its simplicity is what we really brought to the market.
And along those lines, it wasn't a top-down approach. I think you're kind of alluding to that, but the way I see it, it was a ground-up approach, like
Mhm.
providing value and a good clinical outcome, one patient at a time, and then in this area, then that area, and then growing it from the ground up instead of
Yep.
from the top down. And yeah, I think healthcare needs to be much more that way these days. And
It does. It does. And I know you and I are both working on now the next generation. Now that telemedicine is in the mainstream, how do we put into place the elements that really turn it into a healthcare system? How do we catch things early? As a doctor,
right.
because you're always looking for symptoms, but the rest of us out here in the real world, we don't know. I got a pain in my side. I'm going to finish my run, whatever. And, but the simple way of saying this is if you catch cancer at stage 4, it's radiation, chemo, surgery. It's going to change your life, maybe kill you. If you catch it coming into stage 1, it's Dr. Mochigemba saying, hey, I need you to change these lifestyle things and let's check again in a few weeks. And if that doesn't work, then we'll figure out what's next. Um, Huge difference. And I think that's the next generation of care that we're all working on right now. How do we get it early?
You're right. And I know your last company, Recuro, was founded on that principle.
Yep.
And the big thing that I'm working on now is direct primary care. And both
Hmm.
of those things, like Recuro and direct primary care, it helps people with one thing, access to a doctor, right?
Yep.
And so when we have affordable access to a doctor, then we can prevent those things from developing into something big. We can prevent the simple things turning into chronic medical conditions, and
Hmm.
so it's affordable access to care. And so I know my life has been changed in a big way working with you in the early days of Teladoc to provide affordable access to care. And I still love this approach to medicine. It's
Hmm.
not it's not the sick care model that most docs are trained in, but it's so refreshing to be able to have a relationship with your patient and guide them and help them in this way, early access and prevention
Yep.
and
Yep.
management of their chronic conditions. So if there's a business owner or CEO out there listening, Michael, right now, and they've got a large organization, they've got to be very careful with how they manage that. And um, costs are always important, and these days, cost of health insurance as part of the benefit plan is maybe two or three the highest the most expensive things for a company. So if you're a CEO or business owner like that, is there any advice that you could give them that would help them feel a little better, or how they should approach looking at some out of the box solution that they feel is gaining traction or might give them some relief down the road? What kind of advice or next steps might you give somebody like that?
You said a few minutes ago that it's really all about the people. Who are the people that you bring in? What are the quality of the people that you bring in? And then if you're the leadership of a company, you're constantly looking for better ways, more efficient ways to do things. And at the end of the day, it's still about the people. And part of what we did, what you did in the telemedicine world, was you made it easier for people to get to a doctor. They didn't have to take a half-day vacation. Um, and there's a story that happened right before you came into Teladoc that we actually start. I don't know if you've read this book yet, but this is the book that Jay Sanders and I wrote.
Mm.
Tells a lot of the history of telemedicine, and there's a story in the very beginning about a guy named Nelson, whose family said we could use his name, but we never used his last name. But Nelson had a medical issue. He was going to ignore it, and he called in and he got one of the very early doctors, and the doctor said, go to the emergency room. So this was a really simple thing where he wasn't going to, and when the ER doc said, good thing you came in, an hour from now, it would have been really hard to stop this thing. And so I think there's a really discrete example of a very valuable person whose life was saved. But if we're thinking in terms of being leaders, just the simple telemedicine things. Number one, they keep employees from leaving. They allow somebody to talk to a doctor early on, so you catch things early, which means you get through them faster. And that's all about efficiency. And I think as we continue to develop this model of telemedicine and the next generation of care, I think that the business leaders need to keep an eye on what people like Roger is doing and the rest of the world, so that we're constantly allowing the tweaking and tightening of the efficiency model.
Mm-hmm. Okay, so in summary, it's still all about the people, and watch the
Yes, it
people.
is.
Be careful who's trying to sell you something. Look at their background and try to determine maybe what their motive is and what they have to gain, and is there are the incentives aligned, right?
Mm-hmm.
And when all
Right.
of that falls in place, then I think it's going to be good. Um,
Yep.
is there some advice that you could give to a new business owner or budding entrepreneur?
Sure. So I'm sure you give talks all the time. I give talks all the time, and people come up to me and say, well, I thought of the whole idea that became Teladoc in the 90s. And, I think it's not about the idea. Ideas are cool. You sit around with your friends, have um, uh, a glass of water or a beer or whatever, and you talk about ideas. Implementation is how you change the world. It's not the idea. If you have a great idea, then put together a plan and work that plan. Just
Mm-hmm.
like Colonel Talley did with me when I was 11 years old. You
Mm.
know, put together a plan and work it. And may not get you to Mars, but it may create a $500 billion industry.
Very well put. Yeah. Yeah. Very good. Okay. So excellent. Just maybe one more thing. Is there anything else that you would like to say to our listeners who are business owners, CEOs, about value in the marketplace? Anything you'd like to add as in
Yeah.
closing?
Yeah. So look, value is all about the um it, it's a different answer depending on who you're talking to. So our investors value is a return. Our doctors value is good quality care, right? For the patients, value is this is simplicity. So I think it's a big variable, and it depends on who you're talking to.
Hmm. Okay, excellent. Well, I want to thank you so much, Michael, for taking a little time and reminiscing with me a little bit, and then
Yeah,
bringing out some of the principles that are needed for a business to be conceived and then to thrive,
yeah.
right?
It's been
So
fun.
thank you so much, Michael.
All right. It's always good seeing you.